The Best Start family hubs that were announced last week are very welcome and present a great opportunity for the government to address the growing inequalities across our education system that were left behind by the previous government. If resourced properly, the Best Start family hubs expansion could help achieve many of the things we on these Liberal Democrat benches have been calling for, including the early identification of special educational needs and disabilities, contact time with mental health practitioners, and access to nutritional advice. However, the government's ambitious aims must be matched with effective delivery. Children and families cannot afford for the government to get this wrong after many years of early years provision under the Conservatives really starting to disintegrate. Now, the strategy states that high quality early education and childcare boosts children's life chances and enables parents to work. So whilst I warmly welcome plans to invest in training and qualifications to raise the skill levels of the early years workforce, I'm afraid the government's rhetoric doesn't quite meet the reality on the ground. Now, the funding that was promised by the Conservative government for their 30 hours childcare proposals fell far short of what it actually cost to deliver that provision. I'm afraid the Labour's current proposals are also insufficient for nursery, and its ill-advised national insurance hike has not only hampered economic growth, but it has put hundreds of charitable and private nurseries at risk of collapse. Indeed, the Early Years Alliance reports that nearly 1/3 of providers are at risk of permanent closure in the next year, and 4 in 10 would reduce their number of funded places for 3- and 4-year-olds. Now, when coupled with damaging new guidance to local authorities on funding agreements, this government risks expanding the childcare deserts left behind by the Conservative government. And what is the point in expanding early years entitlements for children if parents are not able to access them and because providers are simply unable to fulfil them?